Now, Joanny Mercier from Canada. Retest reliability of clitoral and pudendal arteries blood flow using color Doppler ultrasonography in women with genitourinary syndrome or menopause.
Good afternoon. I have no conflicts of interest, but I would like to acknowledge the Quebec Network for Research on Aging, the FRQS, in the ICS. The internal pudendal artery is one of the main arteries irrigating the pelvic floor muscles and the vulvovaginal tissues. Assessment of its blood flow has been done before, proximally at the level of the ischial spine and more distally at the level of its terminal branch, the dorsal clitoral artery. Reliability of these two arteries has been done before in young women, but it's never been assessed in women with genitourinary syndrome of menopause. So, using color Doppler ultrasonography in women with GSM, the aim of this study was to assess the retest reliability of the blood flow measurements of the dorsal clitoral artery and the internal pudendal artery. 20 women with GSM participated in this retest cohort study. One observer performed the two repeated measurement sessions 2 weeks apart. For each blood flow assessment, 3 consecutive measurements were taken at rest, and 3 other measurements were taken after a pelvic floor muscle contraction task. These are the demographic characteristics of the population. Of interest, 13 out of 20 were sexually active, and 5 were taking hormonal therapy. And in most of the subjects, arteries were adequately visualized. In the table, you will find the parameters measured in this study, which were the peak systolic velocity, the time average maximum velocity, and the pulsatility index. Based on the ICC results, clitoral blood flow's PSV parameter showed excellent reliability in both conditions. Bland and Altman's plots demonstrated minimal bias with a mean difference close to 0 for all parameters, but the 95% limits of agreement range was narrow only for the PSV parameter in both conditions. Similar results were found for the internal pudendal artery. Based on the ICC results, PSV parameter showed excellent reliability in both conditions. On the Bland and Altman plots, mean difference close to 0 was found for all parameters, but again, the 95% limit of agreement range was narrow only for the PSV parameters in both conditions. Our research findings are original as they suggest that peak systolic velocity is a reliable parameter of dorsal clitoral artery blood flow and internal pudendal artery blood flow at rest and after a pelvic floor muscle contraction task. This parameter can form the basis of further research on the perineal vascular properties in this population. Thank you for your attention.
Questions?
I have a question. Very interesting to measure this. What are you actually going to do with this measurement procedure in the future? You mentioned you have further plans. I'm very curious. I have some very big ideas that you could use it. What are you going to do with it?
Yeah, good question. As menopause will have change on vascularity in vulvovaginal blood flow in the area, we think that after a pelvic floor muscle training, maybe it will have change on vulvovaginal blood flow. This is why we did it in those 2 conditions.
I presume there was a variability in the measurements. Did you find any difference with women's constitution, their body size, for instance?
For the what?
BMI?
The BMI? We didn't do
You had the mean value, but I think just the extremes. Women with a high BMI often have more vaginal lubrication, estrogen production. Was there any difference there?
It's very interesting. We didn't look at this, but maybe we'll look at this further.
Yeah, Jannie Dekker from the Netherlands. You did this, thank you very much for this presentation. It's very interesting, I think. You did this study in women who had symptoms. They had the TSM. Did you also have values from women who don't have symptoms after menopause?
Yeah, we did it before with healthy women. It was younger women without any problem, vulvovaginal problems. And we saw that there was a good reliability too.
With younger women?
Yeah.
Yeah, but do you have also data on women after menopause, postmenopausal women, without symptoms?
No.
They exist?
No, we didn't.
This is a naive question. Do you think it could be useful in trauma delivery, studying the delivery trauma?
To look at this.
No, I ask. I don't know. Do you think it could be useful?
Yeah, I think it's good. It could be useful with other population like this one too.
Dudley?
Thanks, Ian. Dudley Robinson from King's in London. Following on from Ian's question, some of these women were taking systemic HRT, some of them were using vaginal estrogens. Did you notice any difference, particularly in those women taking vaginal estrogens?
Between women?
So was there a difference in blood flow between those women taking vaginal estrogens and those women not taking vaginal estrogens?
There was only 5 of them taking vaginal estrogens, and there was 4 of them with vaginal and 1 with systemic, and there was no difference at the first assessment.
It might be interesting to look at in a larger cohort of women.
Thanks.
Any further questions? If not, thank you very much for a very interesting presentation.